DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. Today we're going to have a great show. We're going to talk about parasites, fecal egg reduction tests, and much more with Dr. Grant Crawford. We're here at DocTalk. Thanks for joining us. We'll be right back after these messages.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose FECRT when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodiris, and others. With FECRT's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here with Dr. Grant Crawford, who is a technical services manager and a ruminant nutritionist for Merck Animal Health. Dr. Crawford is a leader in our industry. He spends a lot of time not only in the upper Midwest and Corn Belt, but he spends a lot of time all across the United States working in all segments of our beef industry. Thanks for spending some time with us.
Thanks a lot, Dan. I'm glad to be here.
It's great. So today we're going to talk about parasites, right?
That's right.
So I think it's obvious, but look, what are some of the things that we run into on a day-to-day basis with parasites?
Sure. It's important to remember first off where parasites live, and they live in the gut of cattle and also out on pasture. So if cattle are out grazing green grass, chances are they're going to pick up parasites. And the reason that's important is because parasites essentially rob nutrients from cattle. The number one thing they do is decrease feed intake. So you think of that, we have an idea what cattle are eating, whether it's grazing or from a bunk. And if they have parasites in the gut, those nutrients are not all going to those productive processes like we want, whether that be growth, reproduction, milk production, and also supporting the immune system. So first off, it's a reduction in feed intake. But then secondly, what parasites do is they cause inflammation in the gut. So those nutrients that do get to the gut are not being absorbed out of the gut as well. So it's really a multiple negative things going on when cattle are parasitized. So if we can take care of parasites, we can help those cattle reach their full potential.
Right. And so then when they're coming off of grass and coming into the feedlot or whatever, there's a chance to give those calves a clean start and not have the negative implications at the next level, right?
That's right. That's right. And for those cattle coming into a feed yard, let's say they've been grazing out in the pasture for the last 200 days, or maybe they're stockers, they've been out on grass for another 100 days or so beyond that, they've picked up a lot of worms. And if we can deworm those cattle going into the feed yard, we can take care of that worm load that they have coming off of grass and help those cattle develop their immune system so they can fight off any challenges they get to the feed yard, and also help them utilize those nutrients in the feed yard to maximize productivity and growth in the feed yard.
Right. So I think it's one of those things that a lot of times with parasites, we may not see sick cattle.
Right.
And we may not see anything at all until we go to close them out. And it's always those ones, well, those didn't feed very good.
Yeah.
But we never know, right? I don't think we do a good enough job of diagnosing or following through. We kind of make some assumptions, correct, with parasite programs?
Yeah, that's absolutely right. And I see that quite a bit where people say, well, these cattle don't seem wormy, right? Well, it's a subclinical disease. It's just slowly eating away at the production of those cattle. So, we might have cattle that seem sick, and maybe we've run some antibiotic through those cattle and they don't seem better. Those cattle maybe do have a worm load that we're just not seeing, and if we don't take care of it, it's going to continue to pull away at their efficiency.
Yep. Well, it's a great time for us to take a break. Parasites are vitally important for us to control in our cow herds, and our calves coming into feed yards and stockers. We have Dr. Grant Crawford with us today. We're going to talk about fecal egg reduction tests. We're going to talk about a surveillance tool that they have, and we're going to talk about what it means and what we've been finding. Thanks for joining us.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today, we're going to talk about getting those first calf heifers to breed back. Their success is our success. So here's how we can help them thrive. First, nutrition matters big time. These new moms have incredibly high nutrient requirements. So not only are they still growing, but lactation takes it to a whole new level. So in order to meet those demands, separating and supplementing them away from the mature cows is something we probably should be considering. Second, body condition score is key. Heifers with a body condition score of 6 at calving are way more likely to breed back on time, so let's make sure to be tracking that. Third, early breeding season is a win-win. Start the season earlier for heifers. Heifers bred within 21 days of the first breeding cycle are more likely to breed back, they're going to wean heavier calves, and it's even shown that they're going to last longer in our herd. And last, address energy demands as early as possible. Energy requirements at calving skyrocket almost immediately, and compensating for poor condition after calving is nearly impossible. So focus on the last months prior to calving to make any condition adjustments that you need to. So by nailing these couple points, we boost their breeding success, leading to a healthier herd, heavier calves, and a more profitable operation.
Thanks for watching Cattle Intel by Neogen.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Grant Crawford. We're at Merck Animal Health, where Dr. Crawford serves as a technical services manager, and he is a ruminant nutritionist. He has been on faculty at the University of Minnesota and done a lot in our industry, regardless of the segment of the beef industry. And one of the things that we were talking about today is parasites. And you all have utilized a fecal egg reduction test and provide this for the industry.
Yeah, the fecal egg count reduction test is something that we've been doing for the last 20 years or so. And there's a few different ways that we do it. Some producers will just want to take what we consider kind of a snapshot in time, where they just want to see if their cattle out on pasture or coming into a feed yard or a backgrounding yard have a worm load. So they can take a sample there. Typically what we recommend is they'll take 20 random samples. So it doesn't have to be from individual animals, 20 fresh samples from around a feed yard or on a pasture. Send those
right off the ground?
Right off the ground.
Okay, yep.
And you want them to be fresh samples, so you don't want them to be ones that have been sitting there a while.
Right.
But golf ball size samples, so very small, individually bagged, sent into the lab, and they'll get results back to know what the parasite load of that cohort or that herd looks like. So that's the snapshot. And then to take it a step further, we do the fecal egg count reduction tests. And those are more in depth to look at pre-treatment parasite load, so taking those 20 samples prior to treatment with the dewormer, and then coming back 14 days after deworming and taking 20 samples again. And again, it doesn't have to be from individual animals, but it needs to be from the same group of animals. So if you have 200 cows out on pasture, taking 20 samples, random samples from those 200 cows before treatment, coming back 14 days after treatment, taking another 20 samples. And then we can compare the pre-treatment worm or egg count to the post-treatment egg count to determine the efficacy of that dewormer.
So if you're bringing cows through coming off of grass or whatever, you could take a rectal sample before you deworm them, get your 20 samples while you're working them.
Yep.
Then go out a couple weeks later, 14 days later, and then take the random samples off the pasture.
Exactly. And that would give you a good idea of whether or not that dewormer was working and if you need to deworm those cattle again.
Yeah, there's two things that you're kind of testing, right? What is our worm load?
Yep.
And are the products we're using effective?
Yep. Yep, and the 14 days is somewhat important. It is important because it allows all the deworming products enough time to work, enough time to kill internal parasites, but it's also a short enough time period where cattle are not getting reinfected by what they're picking up off of grass. So that's why the 14 days is important.
Okay. As you want to do this, the best thing to do is to contact your Merck representative.
Yeah, we provide fecal egg count kits, and they're available for free through our Merck Animal Health representatives or on our Merck Animal Health FECRT website, and the lab testing's free as well. So it's a service that we provides us a lot of information about what's going on with not only FECRT and Panicure, but all the dewormers that might be used out in cattle.
Okay, folks. Fecal egg count reduction test, snapshot in time. Work with your local Merck representative to take part in this platform that's provided by Merck at no charge. Understand what your cows have as parasite load, and understand if your product, regardless of what you're using, right?
That's right. Yep.
If it's effective. When we come back, we're going to talk a little bit with Dr. Grant Crawford about the surveillance program in which Merck Animal Health is conducting. You're watching DocTalk, and we're glad you joined us.
Plant the seeds of financial security today with United Patriot Coins Precious Metals Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Grant Crawford, who is a ruminant nutritionist, and he's a technical services manager for Merck Animal Health, works with cattle operations all across the United States and beyond. And we're talking about parasites, fecal egg count reduction, and y'all have a surveillance program going on now, right? Or have had for a while.
Yeah, we do. We have our database, so our fecal egg count reduction tests go into our database, and we track those for all different types of dewormers, whether it's a drench dewormer, a feed dewormer, pour-on, or injectable. And then more recently, what we've been doing is a 5-state surveillance study with 5 of the larger cattle-producing states, Texas, Oklahoma, Missouri, Kentucky, and Florida. And we're working through the state extension services in those states to take pre-treatment samples, and then again 14 days after treatment. So similar to what we described with our fecal egg count reduction test. In fact, it is exactly what we do with our fecal egg count reduction test. Doing those across several different herds in each of those states to determine what is actually going on in those states as far as parasite loads and also deworming choices and the efficacy of those dewormers as well.
And so when we talked about the efficacy of the dewormer, and really what we're talking about is, that it can be resistance of the bug to the dewormer, or it could be inappropriate application or
Right.
multiple things, correct?
It could be any of those things. And for instance, with our database, and this has been confirmed through our surveillance testing in those states, we see roughly 60% efficacy of a pour-on or injectable dewormer. 90% is typically considered to be an effective deworming. Now, that doesn't necessarily mean that those are all resistant herds. It could be underdosing, misdosing, and at the end of the day, though, those products aren't as effective as we'd like them to be. What's been interesting about those 5 states is, like I said, they match up pretty well with what we've been seeing in our database over the years. So it shows that the drench dewormers like FECRT or a feed dewormer like FECRT are highly effective, 98% reduction in fecal egg counts, whereas the pour-ons and injectables don't work as well as they used to.
Yeah, and so we also see some of the combinations, right?
Right.
And that can, what I've been described as if FECRT is getting 98%, that injectable is getting another 90%,
right.
And so it's even just tightening down the screws even that much more against resistant opportunities.
Yeah, and that's what we see basically is 98% efficacy with FECRT alone, 99% with FECRT plus either a pour-on or injectable, which makes sense because if you have 98% with FECRT, so that means 2% that are remaining. And if we have 60% efficacy with a pour-on or injectable, by adding that pour-on or injectable, we get from 98 to 99%, which may not seem like a big thing, but the more eggs we can reduce being shed back onto a pasture, the less risk of infection there is on that pasture for cattle on those pastures.
And less risk of development of resistance.
Right. Yeah.
It's got to be reassuring to see this 5-state platform with extension personnel working on this in a kind of a third-party unbiased, matched up with what you've been seeing for the last however many years.
It is, and it's been very eye-opening for a lot of the extension folks and the producers out in the field, and it's been reassuring to us to show that what we see in our database is actually being reflected in the field.
Well, it's a tremendous service, and work with your veterinarian to use the fecal egg count reduction test in your herd. When we come back, we'll do a wrap-up with Dr. Grant Crawford.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
Hey folks, Dr. Dan here. Welcome to DocTalk's Season of Giving with Merck Animal Health. This week, we're going to give away a heated ResFloor backpack. Now, how do you win this? You go on our website, www.doctalktv.com. Just click Season of Giving, register for our newsletter, and you'll automatically be entered to win this prize. If you win, shoot, we'll even throw in a DocTalk cap with it, and we'll see you down the road. Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson. I'm here with Dr. Grant Crawford. He is a ruminant nutritionist and also a technical services manager for Merck Animal Health. Has a lot of experience in ruminant nutrition, production, and we're talking about parasites today.
Yeah.
And so when we look at different parasite programs, one of the things that we have to address is timing.
Right.
And so let's kind of break it down into the different groups, but let's start with the cows. And what you've seen and kind of, with your fecal egg count reduction tests and efficacy of strategic deworming, when would you have recommendations?
Sure. And one thing important for cows is that even though they develop some immunity and some resistance to worms over time, they're still susceptible to worms. So they still are being infected by worms. So
Right.
The first thing we want to make sure is that they're worm-free going out to pasture at turnout, whenever that may be, sometime in the spring. So if they were not dewormed the previous fall and they came off pasture, we should deworm them prior to turnout. So we make sure they're going out to pasture worm-free. Now, once they get out to pasture, once those pastures green up, there are parasites out there. There are worms out there that overwintered. They essentially burrow themselves into the soil and can survive the winter. So we get pastures greening up, some moisture, some rain moving those larvae around. Cows are going to start consuming those, and that whole life cycle starts again. It takes about 6 to 8 weeks from when a mature cow consumes larvae off a pasture to when they're shedding eggs back on pasture. So if we can remember that 6 to 8 weeks, and deworm again 6 to 8 weeks after pasture turnout, we can kill those worms that are in the gut and also help reduce that life cycle of those worms on pasture. So in most climates, that's good enough. We can do that for summer deworming. When we get further south, we might need to deworm them again another 6 weeks later. But for the most part, if we can deworm 6 to 8 weeks after turnout, and then deworm after those cows either come off of pasture in the fall,
Yep.
or when those pastures go dormant after a frost. So if we do that, we can really get down to 2 times a year deworming, midsummer and fall. And as long as that fall deworming is after they're off of grass, we really don't have to worry about deworming them again until the next summer, because they're
Yep.
not picking up worms again until they get out on grass.
And we have to remember too that whatever those cows are shedding, and that's what the calves then are being exposed to as well. So let's move into calves. When are we looking at the deworming process for them?
Yeah, for calves, they're not grazing right away when they go out on pasture. They're going to be nursing and maybe nibbling a little bit on grass, but you get 60 days on pasture, so they're going to start grazing as well. So if we can deworm them along with the cows at that 6 to 8 weeks after turnout, we can take care of what the calves have picked up too, which is really important, because you think of a cow, they've developed some immunity. They've been exposed to these parasites before, whereas the calves have not at all. So they can be really negatively affected. And you think of that shedding going on out on pasture, those can be very detrimental to calves growing. So if we can deworm those calves, preferably in the feed so we don't have to pull them back in midsummer, we can take care of the parasite load they have at that time. And then once those calves come off a pasture, we can deworm them again. If they're going into a dry lot or a feed lot, we don't have to worry about deworming them again, because they're not going to get reinfected on a dirt lot or corn stalks or anything like that.
Yeah, that's great. Great advice. Thanks so much for being on the show.
Thank you. Always a pleasure.
It is. It's great. Dr. Grant Crawford. Folks, if you want to find us, you can locate us on the web at www.doctalktv.com. Always work with your local veterinarian. And I'm Dr. Dan Thompson with Dr. Grant Crawford, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, Dr. Dan here. Welcome to DocTalk's Season of Giving with Merck Animal Health. This week, we're going to give away a heated ResFloor backpack. Now, how do you win this? You go on our website, www.doctalktv.com. Just click Season of Giving, register for our newsletter, and you'll automatically be entered to win this prize. If you win, shoot, we'll even throw in a DocTalk cap with it. And we'll see you down the road.